Welcome to another edition of Voices of Innovation, the author series. So, what's cool about this book? There's so many cool things I want to tell you about. But one, it's not written by just one person, which is all right. When someone writes a book, and that's fine, and you're getting just a sliver. What's cool about this book is it's written by a whole worldwide community. So you're getting a lot of different perspectives from around the world, mostly North America, but definitely around the world. And so there's a couple things. And so really we're here to promote the book and promote one of the authors. And so the book really is about how do you make innovation happen in your organization? Healthcare oftentimes gets a bad rap that we're not innovative enough, we haven't transformed enough, all those sorts of things. And I think a lot of it's true, but this is a really helpful guide. So it includes a framework for innovation that was developed by HIMSS a couple years back. And then it gives you 4 or 5 real life stories, like the one you're going to hear from Dr. Lee, on how people are actually making these things happen. And so you can take this book and it's a nice framework. So you're getting a broad perspective, best practices, things like that. It's great for these organizations too when they're part of a book and the people that helped write it. But the best part for me, and I know Dr. Lee as well, is all the proceeds go to help cure cancer. So in this case, it'll be Mary Crowley Cancer Research. It's like a medical center, phase 1 clinical trials located in Dallas Fort Worth. I happen to be on the board, so that's the connection. And the introduction was written by the CEO there, Jennifer Fox. And I think you'll just love the book, and you'll know that all the proceeds aren't going to my latest car or whatever, which is 10 years old, but it's going to cure cancer. It's a really cool be part of it. So Dr. Lee, John, you and I go back quite a ways, and I was so thrilled when you submitted to be part of the book. Because we love the clinician voice, and you wrote particularly around the framework. So in this framework for innovation, it talks about communication and eliminating barriers and how important that is to enable innovation. And you wrote, sort of the doctor tech informaticist. And so I would love for you to share a little bit about yourself really quick, and then we'll jump right into, what you meant by, being the technical informaticist.
Well, I'm an emergency physician. I also kind of back into being in informatics and health IT almost accidentally. I don't know if I've actually shared this story with you,
Tell
but
me.
so back in 2006, and I related this actually in my section in the book. The uh, we were designated by our hospital to become fully digital in the emergency department, which was going to be the only department in that entire hospital that was going to be fully electronic. So uh, the they had a meeting. They said, "Well, we need a physician to help lead this effort." And I happened to be working in the ER at that time, so I wasn't actually even involved in these discussions. And so they kind of conferred and said, "Well, who's the nerdiest person in our group?" And so they elected me, and then they informed me afterward. And I was actually quite happy that I got involved. And what ended up happening is that I started noticing a trend that, hey, these are things that I think the system should do, and it shouldn't be that hard to do this. And I would get responses that, well, I don't know, we'll think about it. Or we'll put it on our to-do list. And so I took it upon myself to say, hey, if you're not going to do it, I'm going to do it. So I got actual training, and I became kind of a hybrid physician analyst. And unbeknownst to me, once you switch to Epic, there was an entire community of people like me. You and I talked about Metro Health. They were one of the ones that actually had the most success doing it, and I think a lot of Epic's physician builder program is based off of their efforts. And what I've found is that there are things that, as a physician who is technically adept, uh, as adept as perhaps some of the analysts in configuring the system, there's things that we can come up with that an analyst would not necessarily think of implementing. Or we think of things that a physician may not ask for because they don't know what the system can do. And so you meet in the middle, and there have been any number of meetings or projects that I've been involved with where I will say, hey, have you thought about doing this? And then I'll get the response from our clinical operational colleagues, the system can do that? Oh yeah, we can configure it pretty easily. Or on the other side, hey, have you thought about doing it this way? Well, from the analyst perspective, well, they didn't ask us to do it. Well, I think it's a good idea because of any number of workflow or other quality type of reasons. And then you put it into place and it becomes a big hit. Now, I can't say that everything has been a big hit. I've actually probably received my share of expletive laced uh, text messages from my colleagues. But that in and of itself tells me, that helps me because I had that low threshold of communication where people aren't afraid of talking to me about something. And I've used that as a lever to innovate and make systems better. And I wish and I wrote this that piece particularly because I think there are still a lot of organizations out there where and I mentioned this in the piece as well, they construct what I call this blood-brain barrier. And if you're in medicine, you understand what that means. That certain things don't flow in your bloodstream, but they don't flow into your brain. And that's meant to be purposeful and it's physiologic for any number of reasons. And a lot of organizations have constructed that same sort of barrier. Your clinical operations, you just make the requests. We're IT, we handle all the technical stuff. And to the point that I was trying to make is that a lot of stuff gets lost in that translation
Yeah.
because people don't know what the system can do on the operational side of things, and the analysts and the technical folks may not necessarily understand what uncovered or hidden opportunities may exist that they have not, that operations has not asked for because they don't know what the system can do.
Yeah, you're bringing back a lot of memories for me as well. And I know that my success has been predicated upon my partnerships with clinical informaticists such as yourself. And it was this beautiful partnership where we really worked super well together. Neither one of us would have been successful for those barriers that culturally exist in many organizations. And coming together, the collaboration just enabled a lot of savings of lives, lots of innovation, a lot of savings of lives.
Absolutely.
Don, this is true still today. So I know we were just kind of harking back to like EMR examples because they're pretty easy and pretty straightforward in reality what it took. But like I think about it today, where we have all these chief digital officers and other people without a lot of clinical chops, and I've done everything I can. I don't have a formal clinical background, but I was an anesthesia tech at the Cleveland Clinic and before, and a combat medic, and then I rounded all the time with physicians, but still, I'm not a clinician. And so, what would you say? Like, what would you speak to those in those sort of leadership positions, like beyond the CIO now, the chief transformation officer, the chief digital officer, that don't have a clinical background? Like, how would they, might work best, with someone like yourself?
So I think on the IT and technical side of operations, I would say that bring the physicians and the clinicians in, allow them actually to get their hands dirty. They will not break things, or they won't break things at any higher rate than
Yeah.
than your own technical staff breaks things. And then on the other side, if you're clinical or operational, actually start get your hands dirty and start learning how to use these systems. Now, my path, just because of my own personal intellectual inclinations, led me down this what Epic calls the physician builder path. But you can still do these sorts of things without necessarily getting a bunch of Epic certifications or things like that. Take some courses on generative AI. There's a whole bunch of stuff that's available on the internet. I love a I train myself on a website called Data Camp. I love, that's a unsolicited plug. I love that site. I love their podcasts. Educate yourself. Start to understand what these technical tools can do, because you will be brought in to make decisions on how to use these sorts of technology.
Yeah.
And you cannot think of these as some sort of magic black box. that's something magical happens and then outspits the right answers. You have to understand how these things work.
Yeah. No, this is super good. And just a teaser, why you need to buy the book and
Absolutely.
John's chapter, because it's full of just good practical wisdom. That's what I love about the book, is super practical. We'll drop in the comment section like how to pre-order the book. It comes out July 17th, and there's a discount from the publisher, at least for the pre-orders. So we'll drop that all in there as well. We'd love to have you be a part of the book for the reasons that we already shared. And we really want to see more innovation in healthcare.
And I've already pre-ordered mine.
All right, see you there.
Yeah.
Leadership by example, and I obviously got mine. Actually, mine came as a gift from the publisher. But yeah, go out there and order it. And John, thank you so much. You're just one of the most humble people I know. Great leader, great clinician, and now one of my running buddies.
Yes, I fully appreciate all the different things where we've been able to connect, Mark, Ed.
All right. That wraps it up. Thank you for listening.
Okay, thank you.